Welcome to Pajan Imaging Hub. Today, in our patient and public radiology education series, we look at radiology department, what we do in radiology department, who work in radiology department or diagnostic center. Please remember to like and share my video, and don't forget to subscribe to this channel so that you'll be notified when new video is released. Welcome back. Now, radiology is seen as the main eye of medicine. All that we do in the department is to produce images of the internal part of the body to be seen with the naked eye. We also interpret these images to make diagnosis. A diagnosis is simply finding what is wrong in your body part in question or how that body part is at the time of the test. There are basically three types of persons that work in the department. We have the radiologists, the radiographers, and supporting staff. These supporting staff could be the nurses, health attendants, the desk officers, the receptionists, or the chaperone. Now, before we explain the differences between these staff of the radiology department, let's look at the machines we use to produce and interpret the images we produce in the department. The department is also called Radiation Medicine Department. The reason is that all the machines we use in the department make use of mainly radiation to produce the images, with the exception of few, which we will see shortly. Now, let's look at the machines. The first one is the X-ray machine. This uses X-ray to produce images. It has some advantages. The first advantage is that it is good for producing images of bone and air-contained structures. These areas are the lungs. It contain air, and so it's easier for us to see a structure like this. So we can see the air-contained areas and the other structures like the spine, the heart itself, and the bones. Then we can see the bone here, like the knee joints. When we use dye in X-ray, it makes it easy for us to see hollow structures. Like this is the womb, so we can see the womb here. We can see the fallopian tube outline. This thing by this side is the fallopian tube, but the white one here, the center one is the womb. The one by this side is the fallopian tube. So X-ray makes it easy for us to see these structures. Then the third advantage is that it is comparatively cheap and available. Most of the radiology department has X-ray machines. Then it has some disadvantage. It uses radiation, and therefore it has negative effect. Anything radiation is has negative effect. Then it does not produce cross-sectional images. That is images that have height, width, and depth. Like we can liken it to 3D or 4D images, but we'll see that shortly. Then it's not best for soft tissue and complex structures imaging, like X-ray of the abdomen. We don't see much details because the abdomen contains a lot of soft tissues, the liver, the gallbladder, the spleen, and what have you. Then it is not good also for complex bony structure like the skull. In most of the advanced countries, they don't do X-ray of the skull anymore. They go straight to cranial CT. We look at the next machine. It's called fluoroscopy machine. You can see the machine here. It has both the static one, this one, and the mobile one. This mobile one is called CM because of the shape of this arc here. That is why it is called CM. It is used in the theater. during operation to enable the surgeon to see some structures that they cannot be able to see easily that is inside the body. It also uses radiation, but good thing about it is that it produces real-time images using X-ray radiation. That is, it enables us to see things as it happens in the body, like swallowing. In the people that have difficult in swallowing, we can give them something to swallow, so we can watch that thing they are swallowing as it passes down the gullet, so we can know the area that is abnormal. These are the images of fluoroscopy imager. These are the kind of images we obtain. Fluoroscopy has some advantages. Now, one of the advantages is that it has X-ray component. That means it can be used to produce X-ray images, just like as if we're using X-ray machines. Then their disadvantages include it uses more radiation compared to X-ray, and therefore it is more harmful and not easily available. Most of the radiology department or hospitals don't have CT scan, especially in developing nation. These are some of the images of CT scan. You can see this is a cranial image. You can see this is a hemorrhage. This white something here is hemorrhage. You can see this is an image of the abdomen. You can see this thing here. This is tumor. Is a mass. This is a volume rendering. This is a cranial bone. You can see how we can see the surface of the bone. Look at the next machine, which is mammography machine. Now, this machine is specifically made for production of images of the breast. The women that have done a mammogram will know about this machine. It produces of great details of the breast. But it has some disadvantages. It uses radiation, which is harmful. Then it is limited only to the breast, and it is not easily available. Most of the hospitals and radiology department don't have mammography machine. This is a normal breast, how normal breast image look like. Now we'll look at the next machine, which is ultrasound scan. This almost everyone that have gone to hospital knows about this machine, especially the pregnant women. This machine uses sound, ultrasound, that is sound of higher frequency, to produce images. It has some advantages. One is that it produces cross-sectional images. That is images that have width, height, and depth. You can see the images here. This is a surface rendering, volume rendering of a baby face. Then you can equally see this down one is a liver, this one is a liver, this is kidney. You see, we can see the upper part of the liver, we can see the lower part of the liver, we can see the inside as if the liver is sliced with knife. The same with the kidney. That's what I mean by cross-sectional images. Ultrasound has some advantages. Like I said, it produces cross-sectional images. It does not use radiation and therefore is not harmful. And that is one of the reasons we use it for pregnant women. So the child is safe when you are doing ultrasound. Then it is cheap and easily available. Most of the diagnosis centers, hospitals, and radiology department have ultrasound machine. Now it has some disadvantages. It is limited by structures that contain air and thick or dense bone. You can't use it for skull for adults because of the dense bone there. Then it has limitation in its use in the chest because of the lung that contain air. Then the second disadvantage is that it is operator dependent. This means that it is what the operator says that is taken, unless another operator scans the same patient. In other words, it is less objective compared to the other images that we can easily produce durable hard copy images that can be accessed at any time. Compared to X-ray, are not easily available. Most of the radiology department does not have fluoroscopy machine. Then also it does not produce cross-sectional images. And we'll look at the third machine, which is computed tomography, the CT scan. This is the static one. We only have mobile one. Yeah, that can be used in ICU, but it's rare because probably of the cost. Now, CT scan uses X-ray radiation to produce its image. It has some advantages. The first one is that it produces cross-sectional images. That is, images that have height, width, and depth. Then it produces images that show more resolution or more details compared to the some of the other images. Then it has some disadvantages. It gives more radiation to patient. Is a heavy dose machine. It gives a lot of radiation to patient. The next machine is magnetic resonance imaging, which we call MRI. This machine uses magnetism to produce images. It has some advantages. It produces cross-sectional images. I've shown you how cross-sectional, what I mean by cross-sectional images. You can see this one. This is image of the spine. You can see it separates the vertebrae from the spinal cord and the surfaces, the soft tissue that covers it. You can see how it separates all of them. If it is X-ray, all of them will be superimposed and seen as one layer. But cross-sectional image will separate all the layers. Then this one is the image of the skull, the brain. You can see the brain tissues as if it is sliced. You can see the all the inside. Then it has some advantages. It produces cross-sectional images, as I've said. It does not use radiation and therefore is safer. Then it is good for soft tissues. Example, the brain and spinal cord. I've just shown you the soft tissue. You see the spinal cord. It's able to show the spinal cord very well. Then you see the brain tissues. You can see it well. MRI has some disadvantages. It is costly and not easily available. It is limited by metallic implant. Example, pacemaker, knee or hip implant. Such patients, you don't use MRI for them because of the magnet that is attached or form the main part of MRI. It can magnet or distort such implant in the patient. The next machine is radiotherapy. Cancer patients may know about this machine. It is a costly machine. It is used to kill cancerous cells in cancer patients. It has some advantages. One is that it can cure or prolong life of a cancer patient. Then disadvantages of this machine includes that it uses radiation and therefore causes harmful effect. It can kill or affect nearby normal cells during treatment. It is also very costly and not easily available. Like this is a breast image. This is a tumor which is cancerous. Now during radiotherapy treatment, these surrounding areas that are normal tissue may be killed also in an attempt to kill these cancer cells. And that is the harmful effect I talked about. The next machine is orthopantomography. That is what we call OPG. People that visit dental centers will know about this machine, though it is not easily available. This machine uses radiation to produce images of the teeth. Advantages: it produces a detailed image of the teeth. So you can see this image here. You can see the teeth. You can see the teeth. Then it has some disadvantages. It uses radiation and therefore is harmful. Then it is limited only to teeth and jaw. It cannot be used to produce any other part of the body like in X-ray machines or fluoroscopy machines or CT or MRI or ultrasound machine. This is only for the teeth and the jaw. And of course, it is not easily available and is comparatively costly. The next machine is nuclear medicine. This machine uses radiation to produce images of the body. It has some advantages. It helps to understand the imager to understand functioning of the body part compared to other images. This is a machine that we can use to study body function. The other imagers produces anatomical images, but this machine helps us to understand or produces a map of physiological states of the body parts in question. It can equally be, it has a good advantage that it can be combined to another machine like CT scan to produce both anatomical image and body function at the same time. Then the other advantage it has is that when combined with other imager like CT scan, it can equally produce cross-sectional images. It has some disadvantages. It is costly and not easily available. It uses radiation and therefore has harmful effect. There are three machines here used in nuclear medicine. This is gamma camera. This one is SPECT. This one is PET scan. These are the kind of images we obtain in nuclear medicine. This is a map of the brain, and this is a map of the body. Which of the mentioned or images is superior? This is an important question that many people have asked me. Now the answer is none. None of the images can be said to be superior to others in all aspects of imaging. There will be aspects of imaging that one is superior than the other. Now, the best thing to say is that they are complementary to each other. So back to the staff of radiology. This is where many people get confused. Who is the radiologist? Who is the radiographer? Now, the radiologist studied medicine. The is a medical doctor, but he specializes in radiology as his specialty. So he specializes in all these or part of this equipment that I've listed and the images that have been produced from them. But a radiologist principally interpret those images that I have shown you. But radiographers studied radiography as a course, not medicine. And they are trained to operate these machines I've shown you to produce those images that will be interpreted by the radiologist. Because of role extension, some of the radiographers, by experience and certification also, have also gained knowledge and specializes also in interpretation of some of the images produced by the imagers. There are radiographers that interpret CT scan, interpret X-ray images, interpret mammography images. There are some that operate ultrasound scan, and there are also some that interpret magnetic resonance images, And there are some that operate and interpret nuclear medicine mention and images. Now we'll talk about the supporting staff. When you come to the radiology department, we do have nurses in some of the radiology department that help us to assist us during special procedures. We'll do some minor invasive procedures in radiology department. So they help us to equally maintain those instruments in good state. We have the desk officers, the record officers. We equally have the chaperone. Some cases where we do some procedures that we may need another person to be around, maybe to boost the patient confidence or to avoid litigation. We may need another person who call chaperone to be around. Of course, we have also health attendants that keep the department clean. Thank you. Please like, share, and subscribe to my channel.